Hi, I'm Alan, and I live in Raleigh.
So Al, tell me this, when you very first came in here, what was your major complaint?
Major complaint was that my back was hurting anytime I stood for any length of time, for example, preparing meals in the kitchen, or even walking any particular distance. About the longest distance I could walk without pain was down to the mailbox in my house and back. And then I had to sit down and rest for about 5 minutes before I could get up and do anything else.
And what other things did you try to do to get this handled before you came here?
Basically, I went to an orthopedic surgeon. They didn't do an MRI, but they did x-rays. And because I had had a total hip replacement done, and they wanted to make sure that because of the complaint of the pain in the back, that I wasn't messing up that new hip implant. So several x-rays indicated that the hip implant was perfect and it hadn't moved or done anything bad. But still I was left with the pain, and they really couldn't do anything at that point in time. And I had already done disc decompression on my neck back in 1994-95.
That's right.
And that worked out very well for me. So I was pretty well sure that if I came to you, that disc decompression would help me some extent. I just wasn't sure it was going to help me as much as it has.
Oh, fantastic. I love hearing that. And you're older now than you were in 1995.
Oh, yes. A little bit.
What is your age?
I'm 80 and 3 months.
Oh, fantastic. Well, it sounds as though you would recommend spinal decompression.
Oh, absolutely. Absolutely. In fact, not only would I recommend it, I did and brought my daughter in here for that very purpose because she's having problems with her neck.
Yeah, absolutely.
And so I'm sure that that has helped her. In fact, I talked to her just yesterday, and she's very happy with the way things are going here and helping with her disc decompression of the neck.
Beautiful.
So
Well,
we want to avoid another surgery. She's already had 2 surgeries on her neck and fusing the disc back there, and we don't want to have to go through another one because that's a very risky type of operation in the neck.
Absolutely. Well, and if the first 2 didn't work, it makes you wonder about number 3 anyway.
Yeah. Don't walk around like that. Call you immediately.